Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Acute Myeloid Leukemia AML. Acute Myeloid Leukemia, AML, is a rare blood cancer. It begins when bone marrow cells that make blood cells start producing immature white blood cells called myeloblasts. /r/n/r/n As the myeloblasts multiply, they suppress healthy cells, which can lead to infections, bleeding disorders, and anemia. The leukemia cells eventually may travel outside the blood system and can form solid tumors. /r/n/r/n AML, also known as acute myelogenous leukemia or acute nonlymphocytic leukemia, is very aggressive. However, with prompt and proper treatment it may be curable. /r/n/r/nMd Babul Hosen, Getty Images /r/n/r/n AML is classified into a number of subtypes. These may present with different symptoms and can require different treatments. Common subtypes include /r/n/r/n. The symptoms of acute myeloid leukemia are often confused with other illnesses. Most often, these symptoms are seen in other, more common diseases. /r/n/r/n. Often, the earliest sign of AML is feeling fatigued. Other symptoms of AML can include /r/n/r/n. People with APL have trouble with bleeding and blood clotting nosebleeds, cuts that don't stop bleeding, and blood clots in the legs or lungs. /r/n/r/n. As the leukemia cells take over the bone marrow and blood, they crowd out other blood cells, red blood cells, white blood cells, and platelets, causing complications. These complications can also cause symptoms. /r/n/r/n. These include the following: /r/n/r/n. The cancer can spread to the lymph nodes, spleen, liver, brain, spinal cord, skin, gums, and testicles. /r/n/r/n. It can then form tumor-like collections of leukemia cells called chloroma, granulocytic sarcoma, or myeloid sarcoma. The spread of AML can cause symptoms that include the following: /r/n/r/n. These symptoms worsen quickly if you're not treated. /r/n/r/n. It's hard to know what causes AML. However, certain factors can increase a person's risk of developing this cancer. These include /r/n/r/n. Severe congenital neutropenia, also called Costman syndrome. /r/n/r/n. Several factors increase your risk of developing AML. It's more common in older people, males, and those with a family history of AML. Note that the terms for sex or gender from the cited source are used in this article. /r/n/r/n. Smoking and chemical exposures, including benzene, formaldehyde, chemotherapy drugs, or radiation, also increase risk. People with blood disorders like myelodysplastic syndrome, MDS, or some genetic syndromes are at an increased risk of developing AML. /r/n/r/n. If a healthcare provider suspects AML, they'll do an initial exam and take your health history as the first step toward an AML diagnosis. They will closely examine your mouth, eyes, skin, liver, lymph nodes, spleen, and nervous system. They'll also ask about or look for bruising or bleeding and ask about infections you have had recently. /r/n/r/n. Unlike other cancers, there is no standard staging system for acute myeloid leukemia, /r/n/r/n. They will request blood testing from the lab, which may include the following: /r/n/r/n. The healthcare provider will also order imaging tests to see what's happening inside your body. These may include /r/n/r/n. They'll likely perform a bone marrow aspiration or biopsy, sampling the spongy bone marrow tissue inside the bones. They'll look at what percentage of bone marrow cells are myeloblasts. For a diagnosis of AML, the blood or bone marrow needs to be at least 20% myeloblasts. In normal bone marrow, They are 5% or less. /r/n/r/n You may need to have a sample of your spinal fluid collected via lumbar puncture if your healthcare team suspects the cancer has spread to the nervous system. /r/n/r/n To understand your type of the AML better, they'll do genetic and chromosomal testing on your bone marrow or blood samples. They may also analyze the samples using dyes and antibodies to classify the cancer. /r/n/r/n Acute myeloid leukemia is treated with a combination of medicines and procedures. These include chemotherapy, radiation therapy, stem cell transplants, and targeted therapies. /r/n/r/n Treatment is typically done in 2 phases. /r/n/r/n Targeted treatments used alongside chemotherapy act to destroy specific types of cancer cells. Therapy drugs may include the following: /r/n/r/n Less intensive targeted therapies may be used in people who cannot receive other treatments. These include /r/n/r/n Other drugs, like arsenic trioxide and all-trans retinoic acid, can treat AML subtype acute promyelocytic leukemia. /r/n/r/n Other supports that people with AML may need include blood transfusions if red blood cells or platelets get too low. Antivirals and antifungals may also be used to treat and prevent infections. /r/n/r/n The prognosis for people with acute myeloid leukemia is generally poor, especially for certain types of the disease. AML is the 14th deadliest cancer. One subtype, acute monocytic leukemia, is even more deadly and is the 13th most fatal cancer. /r/n/r/n These are some important statistics related to AML. /r/n/r/n Acute myeloid leukemia, AML, is a rare and aggressive blood cancer. If left untreated, AML can quickly spread. It primarily affects older adults over the age of 65. /r/n/r/n The symptoms of AML are often mistaken for other illnesses. They include fatigue, swollen lymph nodes, pale appearance, frequent infections, unintentional weight loss, fevers without a known cause, night sweats, and loss of appetite. /r/n/r/n Treatment for AML typically involves chemotherapy, radiation therapy, stem cell transplants, and targeted therapies. While the prognosis is generally poor, AML can be cured in some circumstances, and treatments are becoming more effective. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.